Breaking news tonight. The president considers quarantining New York, New Jersey, and Connecticut as cases surge. How police in one state are already targeting New Yorkers. The new study on just how unprepared most cities are. And the nurses protesting outside their own hospital because they lack protective gear. Two NBC News exclusives. Inside the new FDA-approved clinical trial, could that anti-malaria drug really prevent the virus? And one-on-one with the CEO of the ventilator company ordered by the White House to ramp up production. A grim milestone in Italy. More than 10,000 killed by the disease, as Spain's death toll approaches 1,000 a day. The newest test just approved that can provide results in 15 minutes. And new questions tonight. Should you be wearing a mask? And there's good news tonight. The moments that unite us. The neighborhoods singing to the sick.
Get ready for your miracle.
And pledging their allegiance.
This is NBC Nightly News with Jose Diaz-Balart.
Good evening. We begin with breaking news on the coronavirus. Hour by hour, the number of cases goes up, and the deaths, too. Now at more than 1,900 in our country, including more first responders. The latest, a detective with the NYPD. And now also an infant in Illinois, the youngest casualty yet. President Trump today sending a hospital ship to hardest-hit New York while also considering a quarantine for that state and several others. And nationwide, the dire shortage of life-saving protective gear for many healthcare workers and how some are fighting back. We have coverage with our NBC News correspondents from across the country on the latest developments. Kathy Park leads us off tonight.
Tonight, slowing the spread of the coronavirus could mean cracking down on 3 hard-hit states with an enforceable quarantine.
We might not have to do it, but there's a possibility that sometime today we'll do a quarantine, short-term, 2 weeks on New York, probably New Jersey, certain parts, and Connecticut. Restrict travel because they're having problems down in Florida. A lot of New Yorkers going down. We don't want that.
New York's governor questioning that directive.
I don't know how that could be legally enforceable.
His state is bracing for the crisis to peak in 2 to 3 weeks, but today passed 52,000 cases. New York is still scrambling to secure more life-saving resources, even considering manual ventilators.
Someone squeezes the ventilator, the bag, continuously.
As healthcare providers from across the country warn that medical supplies are running dangerously low, U.S. mayors are also sounding the alarm, citing a survey that around 90% of their cities don't have enough masks, test kits, and other personal protective equipment. Nurses in the Bronx staged a protest today saying their lives are being put at risk.
We're afraid.
Meanwhile, there's no slowdown among patients waiting to be tested.
I needed the test. Anyway, I wait for 3-4 hours more, no problem.
You'll wait 3-4 hours if you have to. You need the test that badly.
Yes, sir.
Men and women in uniform policing the pandemic are getting sick, too. More than 500 members of the NYPD have tested positive for COVID-19. Officials announcing today the first officer to die from the virus, Detective Cedric Dixon.
We are hurting, we are crying, and we continue to fight.
Rhode Island is stepping up patrols so that incoming New Yorkers self-quarantine for 14 days. The National Guard and state police are going door to door enforcing the rule and stopping drivers at checkpoints. Tough new measures as more states prepare to become the next hotspot, including Florida, where a 40-year-old from Miami died just 4 days after the diagnosis. His partner, Franco Conquista, urging the public to stay inside.
Just stay home. Don't just think of yourself. It is happening. People are suffering. People are dying.
Kathy joins us now. Kathy, with all the measures in place in New York, any signs that they're working?
Well, Jose, Governor Andrew Cuomo of New York offered a promising update today over a one-day period, Thursday through Friday. He said there was a drop of ICU hospitalizations as well as hospitalizations. Jose?
Kathy Park in New York City, thank you very much. And now to more on that quarantine President Trump is considering. It could mean a drastic shift in already strict rules about staying inside to slow the spread of the virus. But Is it within the president's power? Kelly O'Donnell reports from the White House.
After floating the idea of a multi-state quarantine at least 4 times today, President Trump did not offer specifics as he returned to the White House.
What legal authority you would use for a quarantine, sir?
The president's incoming chief of staff, Mark Meadows, weighed in.
Can you tell us about the legal authority for a quarantine?
Evaluating all the options right now.
Earlier today, the president said he has the power to restrict movement out of the New York, New Jersey area and would consult with governors.
Would that be a more enforceable kind of quarantine, sir?
This would be an enforceable quarantine. And, I'd rather not do it, but we may need it.
Federal law does give the Centers for Disease Control the ability to restrict movement state to state to prevent spread of illness. A federal power rarely used. The CDC says it was last enforced on a large scale during the Spanish flu pandemic 100 years ago. Today in Norfolk, the president waved farewell to the Navy hospital ship Comfort, dispatched to New York City to increase hospital capacity for non-coronavirus patients there. The president said any quarantine would not block deliveries of needed supplies.
And we'll make a decision very quickly, very shortly. A quarantine, because it's such a hot area of New York, New Jersey, and Connecticut. We'll be announcing that one way or the other fairly soon.
Late tonight, after questions and pushback from some governors, the president made a decision. He tweeted that the Centers for Disease Control will issue a, quote, strong new travel advisory that governors will supervise. But the president backed off his idea and said a quarantine will not be necessary. Jose?
Kelly O'Donnell at the White House. Thank you. The president did use a rare wartime power to order automaker GM and a ventilator company called Ventec to ramp up production of the desperately needed life-saving devices. He criticized the companies for moving too slowly. Tonight, the CEO of Ventec speaks to our own Cynthia McFadden in an exclusive interview.
The commitment from GM has been overwhelming.
Chris Kipple says General Motors sent some of its engineers to his factory in Washington State just last weekend.
They've pledged to do this commitment to us at no cost to their labor. GM has really entered into this with the best of intentions.
That was yesterday, before the president's press conference, in which he ordered GM and Ventec to get moving and produce more of the life-saving machines, invoking the rarely used Defense Production Act.
We just were not getting there with General Motors.
Today, we asked Kipple how the president's action yesterday would change things.
We are moving forward as fast as we can. We understand the urgency around this. We are moving full speed ahead.
And you were going to move full speed ahead with or without the admonition from President Trump yesterday.
That was happening, and that's going to continue to happen.
Ventec Life Systems is one of only a dozen or so worldwide manufacturers of ventilators. Since the COVID-19 outbreak, the medtech company has been on the front lines. Usually manufacturing 150 or so ventilators a month, they've already doubled production to over 350 this month at their own facility. But with the help of GM, they plan to go into overdrive.
We plan to be producing together over 1,000 units by the end of April. And of course, with GM's talent and skill, we'll be ramping up to 3,000, 5,000, and 10,000.
Much of the production will take place at a former GM facility in Kokomo, Indiana. GM saying they've already called on 1,000 workers to come back and help. Kipple says they'll keep making the life-saving devices as fast as they can.
The commitment from the GM team and the talent and the manufacturing know-how has really been incredible. And I really feel like this is the best solution for the country to get the ventilators we need to the front lines.
Cynthia McFadden, NBC News.
Overseas, there is no end in sight as coronavirus cases and deaths grow despite drastic efforts to slow the spread. And as Matt Bradley reports from Rome, police are cracking down on anyone breaking the social distance rules.
Agony in Europe tonight as Italy's death toll passes 10,000. A day after another morbid milestone, 919 dead on Friday, the most in one day in any country. Global cases rising above 650,000, with more than 30,000 dead. The Pope cutting a lonely figure with a special prayer for those facing hunger due to the virus. The 83-year-old and his close colleagues testing negative for the virus today. Despite nearly 3 weeks of a national lockdown, the government now possibly extending that date to mid-April. Police are tightening the rules. Fines increased to up to $3,350, up from $230 earlier. In nearby Spain, authorities today reported 832 more deaths, the country's highest daily count yet, bringing the total to 5,690. This ice rink converted into a makeshift morgue. Hospitals struggling to cope. Health workers infected here at an alarming rate. More than 9,000 contracting the virus. Soldiers today disinfecting hospitals, train stations, and flying a drone to disinfect the streets. A national lockdown extended to April 11. But in China's Hubei province, where the pandemic began, a glimmer of hope. 4 consecutive days without new infections. The region now opening. Shoppers and supermarkets, the metro service prepped to restart. The worry here is a new outbreak coming from outside. Beijing announcing a temporary ban on foreigners coming into the country. But even the most stringent measures struggling to stop the disease. Yeah, Jose, the recovery rate may be starting to improve. The government said that 1,500 people had fully recovered from the disease in the past day. That's 3 times the number from the day before. Jose?
Matt Bradley in Rome, thank you. Dangerous storms are hitting parts of the Midwest tonight. In Arkansas, this funnel cloud hit in the northern part of the state, barreling through a neighborhood, causing damage to homes and bringing down trees and power lines. And bad weather near Des Moines, Iowa as well. Dark skies brought rain and hail to the area. Still ahead tonight, fighting back against coronavirus, an exclusive look at how researchers are racing to find out if malaria drugs could be a cure. And throughout the program tonight, we want to spotlight the moments that unite us, like New Yorkers cheering in unison for those on the front lines of this fight. We're back now with a search for the cure and one of the treatments that has many public health officials hopeful. It's an anti-malaria drug that could help people with coronavirus recover quicker. Now a clinical trial for the drug has been approved. Our Gabe Gutierrez spoke exclusively with the doctor in charge.
It is the drug that has sparked the most hope.
With the chloroquine, I think it could be something really incredible.
And now the FDA has fast-tracked a clinical trial to see if it really does work.
Less than a week.
Less than a week. Wow.
Yeah.
That's how long it took the University of Minnesota to get its trial approved, a process that usually takes months. Dr. Tim Shacker, who studies infectious diseases there, is trying to determine whether the common anti-malarial drug hydroxychloroquine might actually slow COVID-19.
So the question we're asking is, if you take hydroxychloroquine after an exposure, will that prevent you from getting infected?
He's looking for 1,500 patients to participate in the trial. In just days, hundreds signed up.
And an interim analysis is likely to occur, in the next several weeks that will tell us with certainty if this drug makes a difference.
The malaria drug, taken in pill form, essentially defends red blood cells against a parasite that's transmitted by mosquito bites. New York doctor Zev Zelenko is not part of the University of Minnesota trial, but he's been taking the drug himself.
I'm extremely high risk, so I am taking hydroxychloroquine.
He's also prescribing it to hundreds of his patients suspected of having COVID-19.
What I found was there were 0 deaths, there were 0 intubations, and I only had 4 hospitalizations.
But there are possible dangers. The Mayo Clinic issued a warning this week that doctors need to determine which patients are at risk of potentially fatal arrhythmia.
We wanted to bring attention to is the issue of drug-induced sudden cardiac death.
At the University of Minnesota, researchers say they hope to know soon if the drugs work.
You're talking months, not years.
If everything goes according to plan, I'm talking months, not years.
Gabe Gutierrez, NBC News, New York.
And joining us now is our medical correspondent, Dr. John Torres. Dr. Torres, the FDA has just approved a rapid coronavirus test that could give patients results in as little as 15 minutes. Is this a game changer?
Jose, with this virus, time is of the essence. The current test takes anywhere from hours to several days to get results. This new test is portable and can deliver results on the spot. It's really going to make a big difference outside of hospital walls. We're talking, though, drive-through testing, airports, even jails. Once a person is positive, they can then be isolated. That can decrease the chance of spreading the disease, which is important to overall containing this disease. Now, the manufacturer tells me that they plan to deliver 50,000 tests a day, and that can be available as soon as this coming week.
So we'll be getting more tests, but what about a shortage of personal protective gear?
Jose, that's a great point. A lot of PPE, personal protective equipment, is used. We're talking masks, gowns, eye shields, and gloves when we're testing patients, especially since some of it is changed out every time we see a patient. So having more tests with more patients is certainly going to stress the supply system even more.
And Dr. Torres, there are new questions tonight about whether everyone should be wearing masks at this time.
Jose, masks should only give you a little bit of protection, so until there are enough masks for everyone, continue to follow the CDC guidelines and only use a mask if you're sick. With this mask shortage, it's important that our healthcare and frontline workers get them first. Really, I'm telling you, social distancing and hand washing, that's still your best protection against catching this virus.
Dr. John Torres, thank you very much. We're back in a moment with help for our heroes. From a hot meal to a warm bed, what Americans are doing to honor our first responders. And this moment that unites us, a 98-year-old woman in Illinois seeing her great-granddaughter for the very first time from a safe distance. Heroes on the front lines are risking their lives around the clock taking care of the sick, and now, so many people in communities across the country are stepping up to help them cope. Steve Patterson reports.
From coast to coast, applause for today's heroes. Now, Americans are creating new ways to help our nation's healthcare workers and first responders.
I would like people to know that there's hope and there's something that we can all do.
In New Orleans, Devin DeWolf is mobilizing relief for the front lines by organizing food deliveries. Inspired by the fight in his wife, Annalise, an ER doctor.
What is that moment like to just get a little bit of relief?
To step into that break room and have the door close, everybody wash their hands and take some food is really healing.
The effort feeding 12 area hospitals.
I think it's just, a way that everybody can get involved and do something and show some solidarity right now.
An aid mission spreading across the country. In New York, Island Auto Group is lending cars to first responders so they don't have to take public transportation.
It was very scary. I get infected or my brothers and sisters I work with get infected.
In Missouri, a Joplin pharmacy started making and delivering its own hand sanitizer.
The idea was to help people that are serving other people in this situation. We want to help them stay safe, stay healthy.
In Texas, a Dallas hotel is offering rooms to local first responders for free.
Let's help out these first responders who are, on the front line trying to save us and trying to get this epidemic, I guess we call it, over with.
And at Elmhurst Hospital in New York, one of the hardest hit in the nation, a simple sign saying thank you, summing up the sentiments of Americans everywhere, grateful to those risking their own lives to save others. Steve Patterson, NBC News.
Still to come, good news tonight, how strangers are now becoming friends and a source of support in communities across the country. And one more moment that unites us. Berklee College of Music students doing what they're so gifted at doing.
NBC Nightly News is brought to you by AstraZeneca.
There's good news tonight about the power of community. It's about strangers coming together, providing safety, reassurance, and smiles to each other during these difficult times. Kerry Sanders has a story.
America has never quite looked like this as we feel so alone.
Get ready, stop.
What does not stop are those moments that remind us we're in this together. A sorority serenades a lonely sister. Stacy Franklin completely cut off. She's a cancer patient, most vulnerable to the virus.
We got you. We're believing with you.
Remembering each other, now more important than ever.
Happy birthday to you.
A nation standing far apart, but close in the ways that matter.
It's your own parade.
Facing down this invisible enemy, an unlikely infantry, armed with scraps of cloth, thread, and the skills, knocking out makeshift hospital masks. This is a mission.
It is now. It feels wonderful to be able to do something to help.
Hi, guys! I miss you!
From Omaha, Nebraska,
We miss you all!
to tiny Windermere, Florida, population 3,500. Parades, teachers and kids socially distanced, but with an unbreakable connection. Children, usually the least likely to have patience, now determined to sacrifice.
I'll stay in the house if it means that we could get like a cure and make sure no one else gets sick.
I pledge allegiance.
In Annapolis, what started as one mom's effort to give her kids structure has become a morning neighborhood ritual.
Mommy, you crying?
Yeah, you don't know when this is going to end.
The pledge now catching on. Across America, patriotic heels dug in with hope from sea to shining sea.
With liberty and justice for all.
Kerry Sanders, NBC News.
And that's NBC Nightly News for this Saturday. Kate Snow will be reporting from New York tomorrow night. I'm Jose Diaz-Balart. Thank you for the privilege of your time. Good night, and please stay safe.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.